Introduction dash. Welcome, ladies and gentlemen, to today's lecture on the fascinating topic of endocrinology and its impact on skin health. Throughout this session, we will delve into the intricate world of hormones and their relationship with various dermatological conditions. Prepare yourselves for an enlightening journey as we explore the complex interplay between the endocrine system and the skin. The first topic we will explore is the role of androgen receptors in sebaceous glands and the pathogenesis of acne. Androgens, such as testosterone, play a significant role in the development and progression of acne. These hormones bind to androgen receptors in sebaceous glands, stimulating sebum production. Excessive sebum production, combined with epithelial hyperproliferation and colonization by Propionibacterium acnes, contributes to the formation of comedones, inflammatory lesions, and the progression of acne vulgaris. By understanding the intricate mechanisms underlying androgen receptor-mediated sebaceous gland activity, we can devise more effective treatments for acne. Moving on to the topic of estrogen and its role in skin aging, we discover that estrogen plays a crucial role in maintaining skin health. Estrogen receptors are present in various skin cells, including fibroblasts and keratinocytes. Estrogen promotes collagen synthesis, improves skin elasticity, and enhances wound healing. As estrogen levels decline with age, the skin undergoes numerous structural and functional changes, including decreased collagen production, impaired wound healing, and increased susceptibility to UV-induced damage. Understanding the impact of estrogen on the skin can guide us in developing strategies to mitigate the effects of aging on the skin. Next, we delve into the influence of thyroid hormones on skin barrier function. Thyroid hormones, especially triiodothyronine, T3, and thyroxine, T4, play a vital role in maintaining the integrity and function of the skin. They regulate epidermal differentiation, proliferation, and lipid synthesis. Alterations in thyroid hormone levels can lead to skin manifestations such as dryness, thickening, and impaired wound healing. By comprehending the intricate relationship between thyroid hormones and skin barrier function, we can develop targeted interventions to restore and maintain optimal skin health. Moving forward, we explore the relevance of insulin resistance in the development of various skin diseases. Insulin resistance, a hallmark of conditions such as obesity and type 2 diabetes, has profound effects on skin health. Insulin resistance disrupts the delicate balance of growth factors and cytokines, leading to chronic inflammation and impaired wound healing. Additionally, insulin resistance influences sebaceous gland activity, contributing to the pathogenesis of acne. Understanding the link between insulin resistance and skin diseases can guide us in developing multidimensional approaches to their management. In this segment, we uncover the effects of glucocorticoids on collagen synthesis and skin elasticity. Glucocorticoids, commonly used for their potent anti-inflammatory properties, can have detrimental effects on the skin. Prolonged or excessive use of glucocorticoids can lead to skin atrophy, impaired collagen synthesis, and compromised skin elasticity. By comprehending the delicate balance between the anti-inflammatory benefits and potential skin-related adverse effects of glucocorticoids, healthcare professionals can make informed decisions regarding their use in dermatological conditions. Let us now explore the intriguing world of neuroendocrine factors and their influence on skin diseases, such as psoriasis and eczema. Neuroendocrine communication pathways involving neurotransmitters, neuropeptides, and hormones significantly impact immune responses and skin barrier function. Dysregulation of these communication pathways can contribute to the development and exacerbation of skin diseases. By comprehending the complex interplay between the neuroendocrine system and dermatological conditions, we can uncover novel therapeutic targets for more effective management. Continuing our exploration, we examine the hormonal regulation of sebum production and its implications for acne treatment. Androgens, insulin, and growth factors influence sebum production, making hormonal manipulation an essential strategy in acne management. Understanding the intricate mechanisms of hormonal regulation allows us to develop targeted therapies that normalize sebum production, thereby improving acne outcomes. Now, let us shift our focus to the role of growth hormone in wound healing and tissue regeneration. Growth hormone, secreted by the anterior pituitary gland, plays a crucial role in promoting cell proliferation, collagen synthesis, and angiogenesis. It accelerates the wound healing process and aids in tissue regeneration. By harnessing the potential therapeutic effects of growth hormone, we can revolutionize wound care practices and enhance tissue repair. Next, we unravel the multifaceted properties of vitamin D as a hormone and its effects on skin health. Besides its established role in calcium homeostasis, vitamin D plays a vital role in skin physiology. It regulates cell proliferation, differentiation, and immune responses within the skin. Vitamin D deficiency is associated with various dermatological conditions, including psoriasis and atopic dermatitis. By understanding the molecular mechanisms underlying vitamin D's effects on the skin, we can optimize its therapeutic potential in managing dermatological diseases. Moving forward, we explore the intriguing role of melatonin in skin pigmentation and UV protection. Melatonin, primarily known for its involvement in circadian rhythm regulation, also acts as a potent antioxidant and modulator of immune and inflammatory responses. It influences skin pigmentation by regulating melanogenesis and protects against UV-induced photodamage. Understanding the multifaceted role of melatonin in skin health allows researchers to explore new avenues for skin pigmentation disorders and photoprotection. Let us now delve into the intricate relationship between polycystic ovary syndrome, PCOS, and its dermatological manifestations. PCOS, a common endocrine disorder in women, is associated with various skin manifestations, including hirsutism, acne, and androgenetic alopecia. The underlying hormonal imbalances in PCOS contribute to these dermatological symptoms. By comprehending the complex interactions between the endocrine system and dermatological conditions in PCOS, we can develop tailored treatment strategies for improved patient outcomes. Lastly, we explore the various hormonal therapies available for the management of dermatological diseases. Hormonal interventions, such as anti-androgens, oral contraceptives, and corticosteroids, have proven effective in treating conditions like acne, hirsutism, and certain autoimmune skin diseases. Knowledge of the underlying hormonal imbalances and their specific targets enables healthcare professionals to make informed decisions regarding the use of hormonal therapies in dermatology. In conclusion, the relationship between endocrinology and dermatology is exceedingly complex, as the endocrine system influences various aspects of skin health and disease. By unraveling the intricate mechanisms and interplay between hormones and the skin, we can develop innovative approaches and tailored treatments for dermatological conditions. This newfound knowledge holds immense promise for transforming patient care and improving overall skin health. Thank you for your attention, and I wish you all the best in your future endeavors in the field of endocrinology and dermatology.